Hello, and welcome to the April edition of Queen City Skin Podcast. April is Rosacea Awareness Month. So this month we're going to talk about rosacea. Common questions I get are, what is causing my red face? And are my breakouts, are they acne or are they rosacea? And so in today's talk, we'll kind of sort through what rosacea is and what might be causing your red face or your breakouts. Go through some treatments and where our patients have found successes. We're going to talk to a patient that had a lot of success with V-beam treatments for his red face that I think is a combination of some rosacea as well as a little genetic tendency towards red cheeks called keratosis pilaris. A little bit of both, but the V-beam treats the redness. And at the end, we're going to talk with my esteemed nurse, Robin Allen. Many of you know, she's very fair skinned, and she suffers from rosacea. And she'll tell you a little bit about her journey and where she has found success. So let's talk first about what is rosacea. So rosacea is a chronic condition of the face primarily, and primarily the mid-face. And the question about whether my outbreaks are acne or rosacea, there's often a spectrum or some overlap. Rosacea does have pimples, but they're a little different than acne. So acne, it's usually the younger patient. Pimples kind of all over the face of varying sizes and including big cysts. Acne also has blackheads. So if you look closely at your skin, and you're seeing blackheads as well as pimples, you probably have some acne. Acne is also a lot of oily skin. So if you compare that to rosacea, you can get pimples with rosacea for sure. Little small pimples, mainly concentrated, mainly in the central face. So medial cheeks and nose, sometimes forehead, sometimes a little bit of chin. And the word we use medically is they're typically monomorphic, meaning they kind of all are the same size and kind of look alike. And some of them are red, but maybe they're not quite like pimples. If you're an adult with teenage children and you look at their acne, and if you're having rosacea, it just looks a little different, a little smaller. Rosacea can have oily skin or it can have dry skin. It can go either way or both. And often with rosacea, there is a significant degree of redness, and with that redness can come flushing, easy flushing, and then associated broken blood vessels as well. The other thing with rosacea that's a little bit different is you can have eye issues. This is called ocular rosacea, eye issues, and we'll talk a little bit about that as well. So there's 4 subtypes of rosacea. The first subtype is what I call the red type. Medically, that is called erythematotelangiectatic rosacea. And I'm not making that up. So erythemato meaning red, telangiectatic meaning telangiectasias are little broken blood vessels. So this is the redness, flushing, and visible blood vessels. So yeah, if you've got blood vessels and a red face, it may just be sun damage, but we can classify it as rosacea. And I do usually make this distinction about red rosacea because in the absence of bumps or pimples, a lot of our rosacea medications, you're not going to have a lot of success with this redness stuff. And we'll talk about that too. The next subtype of rosacea, and I should mention early on, these are not necessarily progressive. They're like little boxes, and you can live in one box and never progress to the next. Or you can have several aspects of the different types of rosacea. So you can have a little bit of papulopustule as well as the red type. So papulopustular, papule means bump, and pustular means little pus bump. So if you're getting bumps and breakouts, that also can be associated with redness and swelling. Again, primarily in the middle of the face, that's papulopustular rosacea. Ocular rosacea is the eye rosacea. And so eye symptoms, your eyes are red and irritated. You may have been diagnosed with dry eye. Eyelids can even get swollen. You can have what looks like a sty. You can also have symptoms of like gritty eye or sand in your eye, and have debris or buildup along your lash line, the stuff you feel like you have to clean off in the morning. So that can be ocular rosacea. And we do treat ocular rosacea. Sometimes I need help from your eye doctor, the ophthalmologist, with this, but we do treat ocular rosacea. And then the fourth category of rosacea is the phimomatous. This is when you get rhinophyma. Rhinophyma is enlargement of the tissue of the nose. So the nose gets really large. Think Bill Clinton. He has a little bit of phimomatous rosacea, a little bit of rhinophyma, and W.C. Fields' nose. So the W.C. Fields was red, and he had broken capillaries, and then enlarging sebaceous glands of his nose. And with this, the skin gets thick and also looks very bumpy. So a lot of my patients come in with red rosacea or the bumpy rosacea, the erythematotelangiectatic or the papulopustular, and they're very concerned that they're going to evolve into the rhinophyma category of rosacea, and that's not necessarily true. But if we start seeing enlargement of the oil glands, we may have a discussion about how to treat that early before the oil glands get too big. So those are the types of rosacea. And as I talk about them, you may think of people you know. So-and-so might have a red cheek. They might have bumps. It may be yourself. And we encourage you to come in and get it checked out. So what causes rosacea? Let's talk first about who most commonly gets it. I already mentioned that Robin, our nurse, is very fair-skinned, and that's common. So the fair-skinned individuals, often with red or blonde hair and blue eyes, and very often from Celtic or Scandinavian backgrounds. So fair-skinned individuals, and they're likely to have someone in their family with rosacea or acne. Now, that's not to say someone with dark skin cannot get rosacea. I've treated all skin types with rosacea, but most commonly is very fair skin. And the age of onset is typically between 30 and 50 years of age. So the causes then kind of become skin type, what your skin looks like, and your genetics, your family history. And if you have a history of being prone to acne, you can be more prone to rosacea. And then there's one other little devil that can cause rosacea. It's called the Demodex mite. Demodex mite. This is a little mite that lives on our skin normally. And this is probably where some of our questions come from that we'll get to. But in rosacea, the environment with the oil and the bumps and your genetic history of responding to inflammation allows this little Demodex mite to collect in follicles and grow to excess population. Not supposed to be that much. And then it triggers inflammation. So all of a sudden, you've got some redness and flushing and bumps. If I see a lot of small bumps all over your cheeks, sometimes forehead, many of my patients are listening, they'll know that I've come after them with a small little blade and I scrape, and rub it on a slide, and I'm looking for that mite. And if you have that mite, we will treat that with ivermectin. Treatment. So let's talk a little bit about treatment of this rosacea. We start with gentle skincare. You want to avoid skincare products that are real harsh, things that have like alpha hydroxy or salicylic acid, menthol or fragrance, or harsh scrubs or things like that. So we'll advise you on some gentle skincare. We may even recommend some anti-inflammatory skincare in there, like green tea and antioxidants and things that are helpful. Now, not everyone's going to react to something with a glycolic acid. We may even recommend that. You have to kind of learn your triggers, but as we're trying to get everything under control, we're going to go down to real gentle. And then there's two basic things that I talk to my patients about as big triggers. And one is dry skin and the other one is sun. So in the winter, we really want to concentrate on good moisturizer. The outside layer of your skin is a barrier. And your skin barrier, if it gets compromised and you're prone to this inflammation from rosacea, well, all of a sudden you're going to be red and flushing and red bumps because the barrier is not protecting the inside of your skin like it should. So good moisturizer and gentle cleansing. And then sun. Sun is such a huge trigger of rosacea. Those that suffer from rosacea, they are often fair-skinned, as we've already discussed, but they often have sun damage. And sun damage can cause broken blood vessels, those telangiectasias. If you're prone to rosacea, those telangiectasias can bring more inflammatory mediators and more redness and flushing. So we recommend a good sunblock, and I recommend one with zinc. If you're super sensitive, I recommend one with just zinc and titanium. And we have some wonderful sunblocks here. You can find them at the store now more readily. It's becoming more popular to have a sunblock with zinc. There's a number of reasons a zinc sunblock is better. First of all, it's very soothing. If you think about, just for example, healing creams or diaper creams, they often contain zinc. It's very soothing. And the way that it works is it reflects sunlight as opposed to a chemical sunblock. Chemical sunblock, just putting it on can trigger some flushing and some irritation. But then the way the chemical sunblock works is it absorbs the sun rays, and that translates to heat in the skin. And if you have rosacea, that heat can lead to flushing. So a good zinc or titanium or both sunblock, and maybe even a tinted sunblock, that can help with the redness and the flushing. We start with other basic things like just cleansing your face twice a day with a gentle cleanser. And sometimes we'll recommend medicated cleansers, either prescription or over-the-counter. Some that contain sulfur can be very helpful, or just some that contain some anti-inflammatory agents. There's a new agent called sodium hypochlorite. It's not actually new, but it's making its way into skincare products, and it's kind of antibacterial and anti-inflammatory, and that can be helpful too. So once we move beyond cleansing your skin and moisturizing it, and using a sunblock and gentle skincare, we may recommend some prescription creams for health. And these include sulfur creams. Metronidazole or Metrogel is a good one. It's generic, so we can usually get that covered with a reasonable copay. There's, over the last 5 or 6 years, a new medication. It's topical ivermectin, which kind of battles that Demodex mite I talked about earlier. That's called Soolantra. And I believe Robin has had success with that, and she'll tell us about that. Sometimes we even use acne medications. But again, we have to really assess your skin and pick the one that's best for you. Sometimes there's so much inflammation that we need to use an oral medication, like a low-dose antibiotic or even a normal-dose antibiotic, primarily for its anti-inflammatory properties. So I'm not necessarily treating an infection, but we're using it as an anti-inflammatory to reduce inflammation. We can even use low-dose or normal-dose isotretinoin. Isotretinoin is the drug formerly known as Accutane that we use for acne, but it works very efficiently on oil glands. So if we're having trouble controlling rosacea, or if you're getting the enlargement of the sebaceous glands on the nose, that rhinophyma rosacea, isotretinoin is a good option. And then sometimes we even use oral ivermectin. That's what I was talking about with the Demodex mite. We have topical prescription medications that control flushing. These are medications that are what's called vasoconstricting. So they constrict blood vessels. And when blood vessels dilate, that's when you get red and flushed and hot. One of them is called brimonidine and oxymetazoline. Mirvaso and Rofade are the brand names of these, Mirvaso and Rofade. And we use them, I would say they're not hugely popular. One reason is they almost work too well. Okay, so if they're vasoconstricting and you put them on your face, it can look really white, really like you had your hand in the freezer kind of look, when everything just shrinks up and looks white. However, many of my patients have had a lot of success with this, particularly when we combine it with a laser treatment to control or treat the telangiectasias in the blood vessels. They pair very well together, and we will often suggest that. So that's a nice way to control the flushing. And then the laser and light treatments. These are treatments such as the V-beam pulse dye laser. We also use what's called a 1064 YAG for bigger blood vessels, and what's called intense pulsed light, or IPL. And all of these are targeting the dilated, enlarged blood vessels or telangiectasias that are also increased in number. They can help your skin look better, will help your skin look more healthy with less flushing and less visible blood vessels. And we'll share with you an interview with a patient that had the V-beam laser. And then the other thing we do is try to find your triggers and avoid them. And we'll discuss this right up front in the first consultation. So what are the things that can kind of flare or typically flare rosacea? And again, I will talk to my patients about maybe even keeping a log, but paying attention to things that flare. One of which is heat or getting overheated. That can certainly trigger a flare because the blood vessels associated with rosacea, they can dilate, and then you have more inflammation in the skin. And when you have more inflammation, you have more redness, swelling, and breakouts. Hot yoga has become insanely popular, but it can really, some of my patients with rosacea, I just have to tell them, you can't do hot yoga. And some of these individuals, for example, can't work in a laundry or in a hot kitchen. It's just overwhelming. It overwhelms the system. Of course, you still need to exercise. Sometimes we recommend taking little ice packs in a small lunch cooler to your workout, and you can apply them to your face immediately after the workout. The opposite of this can be wind and cold. Cold can trigger a flare. The wind as well. I think this is mainly the cold and the wind through disruptions in that skin barrier I was talking about. So the wind can cause cracks in your skin, and so can the cold. It's just like cold grease or a cold candle, like a wax candle. When it's warm, you can bend it, but when it's cold, it breaks. So in your skin, you've got oils and natural moisturizing factors that are just kind of like your skin's natural grease. And when it's cold, it cracks, just like that cold candle. But if you have rosacea, those cracks in the skin from wind or cold or dryness, they can trigger inflammation and release of inflammatory mediators. And again, at this point, you're getting the gist. You get red, swollen, and little bumps. Sun is a big trigger. We've already talked about dryness, sometimes spicy foods. So we have to kind of have you pay attention to that. Irritating skin products and hair products, even like hairspray, can be a trigger. And sometimes alcohol is. But alcohol does not trigger rosacea necessarily, but it sure can trigger some flushing. We advise you to keep a log of everything. So that's basically how we approach and manage. But I thought we would answer some questions. We fielded some questions before. And one of them is, we've already discussed, is can rosacea affect my eyes? Well, the answer is yeah. That's that ocular rosacea, that dry, gritty, grainy feeling, swollen eyes and red eyes. I strongly encourage you to get treatment if you're having any of these symptoms. And sometimes we have to treat those with an oral medication. We've talked a little bit about flares. That was a common question. And again, some of the common flaring things are heat or getting overheated, wind, cold, dryness, the sun, spicy foods, alcohol. We've talked a little bit about the enlarged nose. We didn't talk about treatment. We mentioned isotretinoin, or the drug formerly known as Accutane. But there's also surgery for the enlarged nose. I think probably the best thing is to try to prevent the large nose from happening. Well, that can be challenging. That means getting treatment for your rosacea early, maintaining your treatment, avoiding triggers, getting the blood vessels treated, and it may even mean going on the isotretinoin. If there is a large nose with grossly enlarged sebaceous glands, surgical treatment with tissue removal of that is what's needed. The cost of that surgical treatment is typically $2,500 to $3,000. It's a pretty invasive treatment, time-consuming, and takes a long time to heal from. So it's not a small surgery. So prevention is probably best for that. Another question we got. I am a 22-year-old, and my face looks like a flushed mess. What do I do to clear my skin? Well, here's how we would handle it here. We would invite you in and just take a good look at you. And again, we'd probably recommend a little skincare routine, possibly some prescription medicines. If there are broken blood vessels, we would definitely recommend a laser or light treatment. Otherwise, we might just try some medical treatments and cosmetic treatments with good skincare, see you back. If the redness is persisting, the V-beam pulse dye laser or the intense pulse light is a great treatment for that. So there is hope, absolutely. You don't have to run around with a flushed mess of a face. We can help. And we can often help with very simple things, gentle cleansing, moisturizing, and sunblock. So encourage you to come in for that. And I think this is a great question too. My boyfriend has rosacea. Is it contagious, and can I get it? And I get this question. It might be coming from increased knowledge of the fact that rosacea can be caused by that Demodex mite. Well, rosacea is not contagious, and neither is the Demodex mite. I just recently diagnosed someone with it, and she was asking about going home and how to clean all her sheets and everything. You don't need to. This is a mite that we can find on everybody's skin. It's just that the environment of the rosacea skin either allows the mite to grow excessively, outlive its stay, or these individuals are just prone to having increased amounts of mite and it triggers rosacea. So we just simply treat the mite. We don't eradicate all of it, and you are not contagious, which is good, even though the mites are there. I think we kind of addressed this question, but whenever I work out, my face gets super flushed. Do I have rosacea? Well, the short answer is yes. We can put you in that erythematotelangiectatic rosacea, or the red rosacea category. The longer answer is you may just have fair skin and be genetically prone to a lot of flushing, or you're working out really a lot in a hot environment and it's just overwhelming the system. As I said earlier, I think some of our common medications for rosacea, for the bumpy rosacea, are not as effective for that flushing. But we do have Mirvaso and Rofe, bromonidine, and oxymetazoline that you can try. And you can try some of our tricks about gentle skin care. And I would absolutely recommend some little portable ice packs to put on your face to take down that flushing immediately after your workout. So I think there's definitely help for you, and we can call that rosacea. But the treatment will be individualized just to you, just for that flushing. We've talked a little bit about some of the treatments. The cost is often a concern for people for rosacea treatments. For the laser in particular, laser treatments start at $350 a treatment, and if we use multiple lasers or a large area, it can go up to $600 or even $750. And a series of 3 to 4 treatments is needed for that. And Robin can tell us a little bit about the laser treatment. One comment we got was just, it was pretty brief. They said help. And, I get it. There is help for rosacea. We can diagnose it. We can treat it. We can tell you if you have rosacea or if you have something else. Keratosis pilaris, perioral dermatitis. Is it acne? Is it both? Do we need to treat acne and rosacea? There is help, and we just kind of have to put together different things. We've talked today about prescription medications. We've talked about gentle skin care and moisturizers and zinc sunblocks and avoiding triggers. And even laser and surgical treatments, and all these things can be put together to control rosacea. So I think that's a nice way to wrap up my part about the rosacea podcast today. Is there is help, and that's why it's so nice to have Rosacea Awareness Month in April. We've spent the whole month talking to our patients about rosacea and the help we can offer them. And that's a good segue, I think, to introduce Robin Allen. She's an RN that's been with me forever. But how many years, Robin? 13?
It'll be 19.
19 years. 19 years. And but as Robin has matured with me, she developed symptoms of rosacea. Robin, you want to tell us about that?
I've always had kind of the redness and the flushing, which I started having the V-beam for maybe 15 years ago, I think. And it helped with that. But then just as I got older, it started changing to actually the papulopustular rosacea.
Wow. Well, I can tell you, Robin's under good control, because when she volunteered to speak to our listeners about rosacea, I said, what rosacea? You look great. So her treatments are working, and one of them's the laser. What else, Robin?
Cilantro, which really helps with the bumps and everything.
Yeah, so Cilantro is that topical ivermectin, and not everyone's a candidate for it, but I'm glad it worked for Robin. It can be very helpful.
Yeah, I tried a variety of things, not knowing if it was acne or rosacea, and then was finally like, well, let's try the Cilantro. It worked.
Great.
So, and then I always do gentle skincare. Zinc sunblocks help so much because sun and heat are my 2 big triggers.
Yeah, and poor Robin, we stick her in these rooms where we got machines going and it gets hot. I won't tell you what she does, where all she puts her ice packs.
Yeah, ice packs are my friend.
Ice packs are her friend. Well, that's great. What about eyes? Have you had any, as time has gone on, have you had any eye symptoms?
Not that I've noticed. Probably just more allergy than anything.
Mm-hmm.
Sometimes like grittiness, but I can't tell if it's ocular or if it's just allergy and sinuses.
Yeah, and we often hear that a lot. I don't know if I have eye symptoms or not. When you come in for a rosacea visit or follow-up, I typically will ask about gritty feeling, how long's it been going on, and it may reach a point where if you're having symptoms more days than not, I will recommend some treatment, which are generally like a cleansing wipe or a medicated cleanser, and probably a low-dose oral antibiotic. Sometimes with that ocular rosacea, unfortunately, I just can't control it without that oral antibiotic. So it's great, Robin, that you don't have any of that. That's good. And I can tell you, I also wouldn't know that Robin's been getting V-beam. Her face is just perfect, really. V-beam does such a good job at targeting the redness. Robin, why don't you talk a little bit about what we tell our patients what to expect from a V-beam treatment?
After the V-beam, it can actually look like you're having a flare for a couple of days. It's usually all normal. You can have some swelling from it. The swelling varies to a little bit to where you just feel really puffy, mainly under the eye area. I always suggest Advil, ibuprofen, ice packs. And if it's your first treatment, a lot of people will do it on a Thursday or Friday. So they sort of have the weekend to recover. And once you get that first treatment under your belt, you kind of learn how you're going to react to it. And so you can plan for more treatments in the future. And definitely keep doing the gentle skincare, gentle cleansers, sunblock, absolutely. And if they're using a retinol, I always have to use a real gentle retinol. I can't use anything real strong because it just makes me red as a beet.
Too red.
I get very red. Hold off on the retinol for a few days too, just to kind of let your skin heal up a little more.
Yeah, a lot of people ask, does it hurt? And it does hurt. There's a lot of energy going in the skin. If you have a lot of target, and target is redness, more energy is going to be deposited in the skin because you have more target. So your first few treatments, I think, are a little bit more painful because we're just finding more target if you're more red. It's quite doable. We don't use any topical numbing. It's quick and easy. We can sometimes use a little massager to dissipate the pain. And we use pressure from our fingers. I mean, certain areas are more sensitive than others, particularly around the nose. It is not painful after. And then I don't think you can underestimate, or I wouldn't recommend underestimating the swelling. I look like I've been stung by a bunch of bees. I'm very prone to swelling with these procedures. I like doing V-beam. I have a little bit of redness, but I mainly do it for rejuvenation. It is a fairly powerful rejuvenating laser. 20 years ago, when we didn't have the fractional lasers, we didn't have radio frequency microneedling and microablative radio frequency, many of our patients got a full face V-beam treatment just for rejuvenation. So it can really help your skin look smoother, brighter, and prettier, even while we're reducing the redness and improving the flushing. So multiple benefits from the V-beam, I think. In terms of facials and other things you can do with rosacea, that's often a question that comes up. You can do these. My advice, if I've looked at you and I think that you would benefit from like a pore cleansing facial, I'll recommend that right off the bat, right from the start. Otherwise, I recommend we try to get things under control, and then you can start adding things to your regimen, things that maybe you were once used to. If you want to get back to them, we can start adding them back, and that can include light chemical peels and facials that people like because they cleanse their pores and make the skin surface look brighter and smoother and prettier, and it's good for the overall health of your skin. But in terms of rosacea, it's an individual decision, but very often I'll recommend, let's just get this rosacea under a little bit better control, and then we'll send you back to doing those facials that you enjoy.
Hey y'all, my name is Brennan Priester. I'm one of the nurse practitioners over at Charlotte Skin and Laser. In honor of National Rosacea Awareness Month, we wanted to do an interview with one of our very own Charlotte Skin and Laser clients. His name is Derek. So Derek, I'll hand the mic over to you. And if you want to kind of introduce yourself and give us your backstory and tell us about your journey, kind of dealing with rosacea and what led you to come to Charlotte Skin and Laser.
Thanks, Brennan. So my name is Derek Gaudette. I'm 31 years old. I was born and raised in New Hampshire and moved to Charlotte about 2.5 years ago. I work at a Fortune 100 company, corporate job, working in IT. I'm not a paid actor. I'm just a very happy customer. So thanks for having me. In terms of my backstory, I was very lucky with my skin the first 28 years of my life. Very mild acne as a teen, mostly clear skin. But when I turned around 28, I noticed my face was getting redder and more inflamed. At first, I thought it was dry skin, so I bought some new lotions, new moisturizers, things like that. But that didn't work. And the redness worsened. I started to become more insecure with how I looked in the mirror and in certain pictures. Obviously, I Googled a bunch of things and it seemed like rosacea, but I never had any of the pimply sores. So I really didn't know if it was or was not rosacea. And I
Right.
sucked it up for about a year. And then last year during COVID, I decided it was enough and started to look into options for treatment.
And from there, did you go to a dermatologist or did you see a primary care provider? Kind of walk us through those next steps for you.
Yeah, unfortunately, I had some missteps. I had to go to a total of 3 different doctors before I was satisfied. The first was my primary doctor, who didn't think it was rosacea, thought it was something else, and put me on a 2-week course of antifungal or antibiotic pills. Obviously, that didn't work. Then I finished or visited a dermatologist in Charlotte who looked at my face for about 30 seconds. It was very quick. He asked a couple questions and prescribed me Rofade without clearly explaining the success rate and what to expect. He pitched it as an easy fix, and I left feeling happy, but I would ultimately regret it. I filled the prescription, tried it for a couple of days. It seemed to work a little bit. And one morning I woke up and my face was horrifying, 10 out of 10, super red. Apparently, this is called a rebound effect, and it's very common. And yeah, left me pretty traumatized. Then the third doctor was Dr. Roston at Charlotte Skin and Laser, and she was great. Completely different experience. We chatted for about 30 minutes. She scraped a sample of my skin to rule out certain things, then ultimately landed on rosacea, recommended a laser, and then new mild products that I could buy off of Amazon. I went home and Googled the laser that she recommended, which is V-beam, and I saw a ton of pictures and videos on YouTube, and the results looked amazing, the before and after pictures. However, the post-laser recovery images scared me to death. They were very brutal. The purple bruising, the laser burns, and I was pretty intimidated. So I was optimistically cautious about the first treatment, and yeah, so now I'm here.
5 treatments later.
Yeah, 5 treatments later, I'm a happy customer.
So tell me, just for viewers who are listening who might be in that same position as you, who know that it can be a gold standard type of treatment, pulse dye laser, V-beam can be excellent for the redness of rosacea, but who are just intimidated or a little overwhelmed by looking at these images. Can you walk us through how the laser felt on your skin when you were receiving treatment, and then what your actual recovery was?
Okay. Yeah, the laser doesn't feel great. I'm not gonna beat around the bush there. It feels like someone is taking a rubber band and snapping it against your skin.
Right.
However, you were acutely aware of this and would pause whenever I was flinching too much or looked like I was wincing in pain. The first treatments are worse than the ones later on, because you know what to expect. And eventually you just, kind of squeeze your own hand and just sit there, and you're done in about 2 or 3 minutes. But no, it doesn't feel good. However, the next day was not like the pictures I saw online. I had no bruising, just mild inflammation. Like, it was a little extra red than usual. However, I knew that was the laser doing its work. And a week from that day, it would look much more calm.
All right, Derek. So you had your first V-beam back in November. So if you kind of want to walk us through, you've recently had your 5th treatment. So if you want to kind of walk us through that process.
Sure. Yeah, so I started my V-beam journey in November. I had a treatment once a month for the first 4 rounds, and then the 5th was spaced out 2 months, and now I plan on one treatment per quarter and maybe ramping down to twice a year as a maintenance plan in the future. The results are amazing. Every time I go into the office, you show me the pictures, and the story is pretty clear. And really, the only thing I've changed in those months is the new moisturizer, which is DML Forte, and these treatments, and I couldn't be happier. Granted, I know I'll never be back to 100%, perfectly toned, clear skin. However, I no longer have stress or feel insecure about my face, and that's exactly what I wanted. The redness is much more subtle, and I've accepted that this is okay. And I want to give a huge shout out to you, Brennan. You're a sweetheart and always did a good job. Always nice, professional, and I never felt like I was being judged. And most of all, never had any bruising or swelling, which was my number one fear going into this. So overall, it was a great experience.
And well, thank you so much for that. It's patients like you that make me so grateful to do what I do and get to come to work on a daily basis, and help patients just feel and look better. I think it aligns perfectly with our mission statement and why we do what we do here at Charlotte Skin and Laser. So thank you so much, Derek. We really appreciate you coming on.
And my pleasure.
So we've covered a lot of territory today. I hope we have found an audience that was interested, because it's estimated that some 14 million Americans do suffer from rosacea of some sort. And I think the lasting message should be there is help, and it's just a matter of putting together the right individualized program for you. We encourage you to get help today. Well, thank you again for listening to this month's edition of Queen City Skin Podcast. It's always a pleasure chatting about the things that I love in dermatology. Could talk forever, but we're going to wrap it up here, and I appreciate your attention. Goodbye.